Hi everyone, welcome to today's episode of Aesthetics and Wellness by Dr. Yusra. On today's episode, we are talking about Radiesse. We've done a quick whistle-stop tour about this particular product that is a collagen stimulator and an incredible filler. It's one of the highest G' fillers in the market globally and is also the most researched filler in the market in the globe. So this is a filler that you want to know about, and you can use this on the face, on the body, on the neck, on the hands, and it's one that you really need to know about. So I hope you enjoyed this episode. Hello, Sophie. So today we are on the podcast talking all things Radiesse, which is one of the longest performing fillers in the world, actually. It's one of the most globally renowned fillers and has been around for over 20 years and is one of the most researched fillers in the world. There's over 200 clinical papers. So I know that you've come with lots of questions. Let's go.
So I suppose the first question is, what is Radiesse and how does it work?
So Radiesse is a calcium hydroxyapatite dermal filler. So what does that mean? It's a filler that is not made out of hyaluronic acid. The majority of fillers are made out of hyaluronic acid, which is a sugar molecule, which hydrates the skin as well because hyaluronic acid holds water. It's hygroscopic, it's hydrophilic, it loves water, so it pulls water into the area. Whereas calcium hydroxyapatite, which is what Radiesse is made out of, is a non-hydrophilic filler. So it doesn't suck water in. So it is a filler that can be used to plump up fine lines and wrinkles. It can be used to reshape the face, and it has a variety of different FDA approvals. But it is not made out of hyaluronic acid. It is made out of calcium microspheres, tiny, tiny spheres of this white calcium hydroxyapatite, the same thing that your bones are made out of. And in this gel, which is a Radiesse gel, you get 30% calcium hydroxide or hydroxyapatite, and 70% is something called CMC, which is a carboxymethyl cellulose carrier. And when you inject it, the CMC carrier breaks down over time, over approximately 3 months. And what happens is these calcium hydroxyapatite microspheres create new collagen. So they are not just a dermal filler, they are collagen stimulators, and they will stimulate type 1 and type 3 collagen, which is a long-lasting collagen and also collagen in response to trauma. So what that actually translates into is improvement in the skin quality, improvement in structure, and it can be used on the face. It can be used in the jawline. It's one of my favorite fillers to use in the jawline. It can be used in the hands. So it's FDA approved for the hands, but it's also just been FDA approved for the décolletage in the neck area, which means we can use it for collagen stimulation in patients who have crepey lines in this area. So the beauty of it is, unlike normal fillers, which do take up water, is you really use it for areas where you want high definition, but you don't want volumization, you don't want edema, you don't want water retention, you don't want puffiness. For me, it's my go-to in the jawline because I personally don't think that women should look like they've got Buzz Lightyear jawlines. I don't think that hyaluronic acid fillers in the jawline is a very good idea in large volumes because it might look good on day one, but remember that we now know that fillers last not just 1 year, 2 years, 3 years, but 10, 15 years. So if you're putting something that's going to draw in water into the jawline, as you're aging, that's going to create heaviness, puffiness in the lower face. So it's, in my opinion, not a good idea to put hyaluronic acid in the jawline. And actually using something like a calcium hydroxyapatite filler like Radiesse is a fantastic option because it's going to give definition, it's going to give collagen stimulation, it's going to tighten up and give you precision, stimulation of the collagen, improvement of the actual skin quality without that puffiness happening over time.
Okay. So what are the benefits for patients what would sort of be the ideal patient that would come in and you would say, right, Radiesse is for you?
So, of course, with all things, we have to do patient selection, right? Like I say, my go-to for jawline tends to be Radiesse because I know that it's going to not just work well and give them the effect that they want there and then, but over the course of the next 3 months, they're going to get more collagen stimulation and it lasts a long time. So you get a lot of bang for your buck. It's also the filler that has one of the largest G' on the market. So what does that mean? That means it has the most, the ability to create a lot of lift. Okay, so it creates projection. And out of hyaluronic acid fillers, it outperforms hyaluronic acid fillers in terms of projection. So where you want projection, you want definition, you want a lot of volume. and you want to take a filler and use a filler that's got a lot of bang for your buck, plus you get the collagen stimulation and you get the longevity, Radiesse is a great product. It's been around for a really long time. There's over 200 clinical papers on Radiesse and more coming out because people are researching its ability to formulate collagen and how it ages within the skin more and more and more. And it's one of many different biostimulators that we use in the clinic. As you know, we use a number of different biostimulators in the clinic. But for the jawline, for that immediate plumping effect, is that 2-in-1 where you can use it as a filler to plump up the lines and wrinkles and know that you're going to get that collagen stimulation over time. So that's one thing, is in the jawline. The other thing is for patients who have acne scarring.
Yes.
So I use a different technique than using it, what we call neat.
Yeah.
So neat is where you use a product that comes straight out of the box and you inject it as is. Using it hyperdilute is when we will dilute it with either saline or a hyaluronic acid gel. Usually a very thin hyaluronic acid gel. So it doubles up as a skin booster. Yeah. And in this way, we know that when you're hyperdiluting it, you can use it to not volumize. It's not for definition. It's not filling lines and wrinkles, but it's as a skin booster, so to speak. Yeah. So again, because of its ability to stimulate collagen, you get plumping up of the tissues. And it's great to be used for subcision, where we're cutting scarring. And this can be used for any scars, not just acne scars, any scars. You go underneath the scar, you cut it, utilizing a specific tool, and you release the scar tissue. And underneath it, you're laying down micro droplets of this collagen stimulator, which will plump up the tissues. Okay. So I use it for patients who want a quick effect and who want that collagen stimulation as well, and something that's going to last a lot longer. And those patients who might not want hyaluronic acid in their face. Yeah. Now with its latest FDA approval, we can use it for laxity in the neck. We can use it in the arms. And actually off-label is a use where we can use it in the body as well. So there have been clinical trials looking at the impact of calcium hydroxyapatite fillers for the body. So laxity in the arms, lines and wrinkles in the arms, even the abdomen. The way that we would dilute it is slightly different. And it's very important that you're diluting it according to the area that you're injecting. Yeah. But in that way, we can use it off-label, which means it's not licensed to be used before the companies come and say, well, we haven't licensed it to be used in that way. Yes, this is what doctors do a lot, is that they will use their clinical autonomy, assess a patient, and they can utilize specific drugs and prescribe it for a patient if they know that it will be of benefit. Yeah. And we know through clinical trials and research that calcium hydroxyapatite has the ability to stimulate collagen and therefore treat laxity, not just in the face, but also in the body.
It's so amazing how we've got treatments now to treat the body, because we have so many patients coming to us, don't we, who, yes, they're concerned about the face, but their body as well. So it's amazing that we now have so many little tools in our toolkit to be able to help. Yes. The next part, I suppose patients often like to know, is it a one-session treatment? Is it multiple? How often will they need it?
Great question. Again, it depends how you're utilizing it. Okay. If you're using it neat, which means out of the box and you're not hyperdiluting it, it is a one-to-one correction. So if you came in and you had deep lines and folds in your nasolabial folds, so there's nose to mouth lines, and you just decided to have Radiesse, which you could do, then usually you would need one session, unless you needed a retreatment later. So the result that you get on the day, because you're not going to get a hydrophilia, you're not going to get water uptake, is likely the result that you will have for about a year before you need to repeat it. So if you're using it for volumization or for projection or for definition of the jawline, so if you want you want to target the jowls and you want to create tightening and lifting, so to speak, or definition at the jawline, you can use Radiesse, and usually your results will be a one-to-one. Over the course of 3 months, the gel carrier will break down, and then you will start to get an addition of collagen, so the overlying skin will get better. We know that results last 12 to 15 months, so it is a long-lasting filler before you will need to have it repeated. This is average, right? Yeah. So we are all human beings. We are all different. Different patients will react differently. Their metabolism, their lifestyle, their skin quality will alter the dosage required. But on average, your one-to-one correction will usually last you 12 to 15 months. Which means if you're happy on the day, that results will usually last you. If you are trying to do collagen stimulation, so remember in the neck, you don't want to be putting large amounts of filler because you don't want a heavy neck. What you do want is you want a tight neck. You don't want a neck with crepiness, or if you're treating the décolletage, particularly women who are sun exposed, they tend to start to get vertical lines in their décolletage area. between their breasts. And that can be something that can impact their self-esteem and also the quality and the health of the skin. We know that calcium hydroxyapatite will stimulate collagen, but one session is not going to be enough. So most patients will need 3 sessions, 2 to 3 sessions, usually spaced 6 to 12 weeks apart.
Okay.
And like if you break a bone, your bone is not going to heal overnight. Collagen stimulation takes time. Usually if you break a bone, you go to your doctor will stabilize your bone and your cast will be removed after a few weeks to months. And the bone will not completely remodel for 3 months. It's the same thing. When we're creating trauma or placing these calcium hydroxyapatites, which is the same of what's in your bone, it will take time to remodel that. It will take time to stimulate collagen, and it's 3 months where you'll see that impact.
Okay.
So you don't want to retreat too often.
Yeah.
And the dosage will depend patient to patient. And naturally, the more damage, the more likely you are going to need to have further treatments.
Yeah.
But it is a great treatment. The only thing with collagen stimulation is you need patience. If you've got a big wedding coming up and you're coming in, a month before your treatment, you're unlikely to achieve the result you want.
Yeah.
You'll need to space it at least 3 months before your event so that you can get the maximum out of your treatment.
Yeah.
And I think when it comes to crepiness in particular, when we're treating with collagen stimulators like Radiesse, and there is a different calcium hydroxyapatite filler now that's recently come out by Allergan. And that one also has calcium hydroxyapatite in it. What we know is that calcium hydroxyapatite will stimulate collagen in a non-inflammatory pathway. So what does that mean? That means it's not creating inflammation. It will create collagen by placing a scaffold.
Okay.
And that scaffold is where let's say your collagen cells, your fibroblasts like to attach onto and lay down new collagen. So it's a scaffold upon which collagen will grow. There are other biostimulators that create inflammation. And those ones I wouldn't use in patients who have an autoimmune profile.
Okay.
So if they have an autoimmune condition, Sjögren's syndrome, rheumatoid arthritis, diabetes, I'm a lot more cautious and conscious about using products that may induce inflammation. And so Radiesse is a really good product to use as an alternative because it's not going to induce inflammation.
Okay.
But what it will do is it will stimulate collagen and elastin. I know you're going to get fibroblast proliferation. So the interesting thing that we're starting to learn and see more and more in the literature is that the health of the skin becomes better. It's not just about the aesthetics.
Yeah.
It's about the health. Because as we are getting older, and I'm like a decade older than you or more, we're not going to tell the world. What happens is your body starts to slow down and its function starts to slow down. That's what happens with aging. And this is from top to toe. Your bone remodels, your muscle mass reduces, your bone density reduces, and the cells in your skin start to age and they aren't functioning as well as they once were. And the skin cycle starts to slow down. So in youth, your skin cycle is about 40 days, which is 6 weeks. So from the moment a skin cell is born to the moment it dies, it's 6 weeks. And it gets replaced every 6 weeks, which is why we say to our patients, listen, your skincare, you're not going to reap the rewards of your skincare for at least 6 weeks. You need to be on it for at least 2 skin cycles to see a difference. So you need to stick to it for 3 months. You need to be consistent. And the number one most important thing about skincare is consistency. Without that, you'll never reap the benefits. When it comes to aging, that skin cycle goes from being 6 weeks or 40 days to 50 days. And then as you age a little bit more, 60 days. And as you age a little bit more, 70 days. So it just chugs along a little bit slower. And what happens in the body is when you have aging cells, they die. They're called senescent cells. But in the skin, the senescent cells, the dying aging cells, they don't just die and leave the skin. They linger, they hang around. And it's kind of like, if you think about rotten apple spread, this is what happens with senescent cells. When they sit there in the skin, they leak out messages. They communicate with their neighbors, their neighboring skin cells, and they go, hey, I'm aging, you need to age as well. And then that aging cell tells the next cell, and it starts to spread. So senescent cells stay in the skin, and they leak out negative messages to their neighboring skin cells and tell those neighboring skin cells to start aging, which means that they don't function properly, and they start to make... They don't turn over as quickly, and they start to lay down more melanin. So you get more melanocytic activity, which is where you get age spots or dark spots or pigmentation. And it's just, you're more likely to develop squamous cell carcinomas, basal cell carcinomas, so age-related diseases. When we are injecting Radiesse, what we are finding, which is super interesting, is that not just does the skin look better, functionally, aesthetically, we've made it better, but the health of the skin starts to get better because those senescent cells are being switched off. So you're reverse engineering aging in the skin, and you're actually making the skin healthier than it once was. And that's really interesting.
Oh, this sounds like the perfect treatment.
I know. I need to get in.
Once this goes out and all our patients see it, it'll be Radiesse non-stop. Another question we get quite a lot is, are there any risks, side effects with Radiesse that patients need to be particularly aware of?
Yes, Radiesse is a non-dissolvable filler. So this is not something to be done in the hands of anybody except a medical professional because it cannot be dissolved. And if it is injected in too large volumes or inadvertently injected into or next to a blood vessel, it can cause a vascular occlusion and it can be very difficult to reverse it. So it should not be injected in high-risk areas like, for example, the nose. It's an absolute no-go in the nose.
Okay.
The last thing you want to do in the nose is place something that you can't dissolve.
Yeah.
Because the vessels in the nose communicate with the eyes and you can get blindness. So it's a no-go for there. It's also a no-go in the temple and it's a no-go in the lips. Any areas of lots of mobility, you don't want to be placing calcium microspheres. They are little hard spheres. You want to be placing them where you want definition. You want to replace bone structure.
Yeah.
So jawline, cheeks, where you might be losing bone because you're aging. You want to use something with a high G prime that is made out of bone that will stimulate collagen and give you back structure and definition. But it's really important that it's done in the hands of a medical professional who has the ability to inject safely and can manage a complication in the rare event that it can happen. Now, although that sounds scary, I want to tell you that Radiesse has been around for over 20 years and is the most researched filler on the market in the world globally. Okay. So it is a safe product in the right hands, but it does come with a risk profile, yes.
Okay. I suppose my final question to finish this off is, can it be done in conjunction with other treatments or is it sort of a standalone treatment?
Oh, nothing that we do is standalone, really. No. And the great thing about collagen stimulation is that it's a great first step in your treatment plan. Because if you think about it, your skin is your canvas, right? Yeah. Everything else is underneath. So your skin represents you. Your skin is what you see and it's what other people see. If you optimize the health of your skin and your skin looks good and you've woken up the fibroblasts are the cells that make collagen, that make elastin. If you've woken them up by doing something like, by using Radiesse, and then you do radiofrequency microneedling, for example, what you have done is you have sprinkled your skin with fertilizer. It's awake, it's functioning properly, it's healthy, you've quieted down the senescent cells, you've stimulated everything, it's working as its best possible self. Yeah. And then you're doing microneedling, you're going to get 10 times better results than if you did it on a base that is tired, unhealthy, aging. So it's a great precursor treatment. It's a great treatment to do to optimize the health of the skin. And then if you can have it as a standalone by all means, but if you then wanted to have other treatments like radiofrequency microneedling, like laser or anything else, it's likely you're going to get a much better result because all those fibroblasts you've woken up and stimulated are now ready to lay down even more collagen. Remember, radiofrequency microneedling is a treatment where we are inducing a wound response. Which means if you've woken up the fibroblasts, you're then putting the microneedles into the skin. All those fibroblasts you've woken up are going to lay down new collagen. Okay. And again, if your skin is optimized and your skin is healthy, everything else that you do is going to look much better. And also, you might find when your skin looks better and looks tighter and is healthier, you don't need as much filler as you might have needed had you not had that treatment.
Perfect. Thank you so much for sharing.
Thank you for having me. Thanks for coming on.
Thanks.